Pancreatitis and its clinical presentation. Acute pancreatitis. The spectrum of acute pancreatitis varies from mild, which is usually self-limiting, to severe, in which the severity of the attack correlates with the degree of the pancreatic involvement and complications. Typical signs and symptoms and their incidence include abdominal pain, 95%, radiation of the pain to the back, 50%, abdominal distension, 75%, nausea and vomiting, 80%, low-grade fever, 75%, hypotension, 30%, mental aberrations, 25%, and jaundice, 20%. The initial presentation ranges from mild abdominal discomfort to excruciating pain, shock, and respiratory distress. Abdominal pain, the major symptom of nearly all patients, is usually epigastric, often radiating to either of the upper quadrants or the back. The onset is usually sudden, and the intensity is often described as knife-like or boring. Generally, the pain of acute pancreatitis tends to be steady and usually persists for several days. The majority of patients with acute pancreatitis recover uneventfully. Mortality rates appear to be influenced by the etiology of the disease and whether the acute attack is an initial or recurrent episode. Chronic pancreatitis. The main features of chronic pancreatitis are abdominal pain, malabsorption, weight loss, and diabetes. Prolonged jaundice occurs in about 10% of patients. Abdominal pain is the most prominent clinical feature and is classically described as dull, constant, epigastric, and radiating to the back. Diarrhea may occur secondary to fat malabsorption. Nausea, vomiting, anorexia, and weight loss are often seen. Pancreatic diabetes is usually a late manifestation commonly associated with pancreatic calcification. Patients with alcoholic chronic pancreatitis usually present with an initial acute attack followed by successive attacks that are slower to resolve. Continued ethanol use leads to chronic abdominal pain and progressive exocrine and endocrine insufficiency. In 50% of patients, the pain diminishes in about 5 to 10 years after the onset of symptoms. And that's the clinical presentation of pancreatitis. Have a great day.